Morgan Buddha. I'm a family medicine physician that works for the family medicine department in Johnson City and Kingsport. Well, I knew I wanted to become a doctor a little later in life. I knew always that I wanted to be in the medical field somehow. So I grew up playing a lot of basketball and running track and field, and I had a lot of sports-related injuries. So I was in the doctor's office quite a bit. But my senior year of high school, I had a career-ending injury in basketball. And that really is what kind of fueled my fire to be in medicine. I had to have surgery. I was in the doctor's office multiple times. I had lots of physical therapy. And I thought, gosh, this is just so cool. I really want to dive in. What do I need to do to get into medical school, right? I have a neighbor who I grew up with who was the hometown internist or primary care physician. So I started asking him lots of questions and figuring out just how cool it could be to be a doctor. So I knew what I wanted then and I went for it. I chose family medicine for a lot of reasons, but it really comes down to my patient and physician relationship. So I think family medicine is a great field where we're able to advocate for patients and communities. We're able to serve patients in our community. The most rewarding part of my job has to be building my relationships with patients and connecting with them. I'm also really excited to teach medical students and resident physicians. My overarching goals for patients would be to meet them where they're at in their health journey and find ways that we can progress and get better every day. My ideal day at work would probably be patient care, somehow finding a way to incorporate some lunch and learn so that I could learn. I'd like to be able to teach medical students or resident physicians sometime in that day and find time for a walk. Things in my past that have helped me provide better patient care now would be, honestly, my training. So I think I've had really great training in medical school. I went to Quillen. I also was able to go to the University of Minnesota for residency. I spent a few years in Northern Michigan. So I do think that I've had a good breadth of knowledge and expertise in the Midwest, as well as being able to come back home to East Tennessee. Another way that I can provide better patient care is that my experiences as an LGBTQ affirming physician in Appalachia and America, and as a member of that community, has also been a way to provide equitable care to all of my patients. I love living in the mountains. These are my home, right? So I love being able to drive into work and see the mountains and think, gosh, I get to live here. Another thing I love to do is to be outdoors and be in nature. Love to hike, love to mountain bike and general biking. So I'm really excited to be back. Hi, I'm Dr. Buddha. Thanks for spending some time with me today. We're excited to see you at our ETSU Health Family Medicine Clinic.